Bubonic plague, Black Death. The bubonic plague is the most common form of plague caused by the bite of an infected flea. If you were a medieval peasant back in Europe, you'd stand a 2 out of 3 chance of being among the 200 million it killed. An annoying rat would take a nap on your straw bed, and within a week you'd be the new victim of the Black Death as you experienced extremely excruciating symptoms including high fever, painful swollen lymph nodes, and severe fatigue. Without antibiotics, over 70% of people who got the bubonic plague died from it. It wiped out entire towns and spread so quickly that it killed so many people that there weren't enough survivors to bury the dead. Tuberculosis. Tuberculosis is a dangerous infectious disease that usually attacks the lungs. It's caused by Mycobacterium tuberculosis, which spreads through the air when someone with it coughs or sneezes. Imagine this. It's 1890 and you begin developing a horrible cough that lasts for weeks, progressively worsening chest pains, starting to cough up blood, experiencing unbearable fatigue, a high fever, and night sweats. As the disease wore on, it would over time simply eat your lungs from the inside out. Upon your death, as the doctor opened your body to determine the cause of death, he would see your lungs resembling cheese, as the bacteria had made multiple hollow holes feasting on the lungs. Without a 6-month-long treatment regimen with multiple side effects, anyone who gets this disease has a 60% chance of dying. Ebola. The Ebola virus, a highly lethal and terrifying disease, gained its infamous reputation due to its severe symptoms, including bleeding from multiple body organs. This virus attacks the body's immune and vascular systems, causing widespread damage. Victims often experience symptoms like fever, fatigue, muscle pain, and intense headaches before progressing to more severe stages. One example of this case would be in 2014 when one day a man would unknowingly eat contaminated meat. The next, he'd be suffering from one hallmark of Ebola's symptoms, hemorrhagic fever, which would lead to bleeding from various organs such as the eyes, nose, and gums. This bleeding is due to the virus quite literally shredding through your blood vessels, and in a last-ditch effort, your brain throws everything it has at it through a cytokine, kind of like killing a hornet's nest with a nuclear bomb. Ebola's gruesome symptoms make its current mortality 90% of all those infected, meaning you'd have a 9 out of 10 chance of dying. Leprosy. Leprosy, caused by a bacterium called Mycobacterium leprae, often starts with pale or reddish patches on the skin that are numb to the touch. If left untreated, it can cause severe nerve damage, skin lesions, muscle weakness, and paralysis. Over time, your fingers, toes, and nose would begin to fall off, leaving you disfigured permanently. However, contrary to what most believe, leprosy is only transmitted through prolonged close contact with an untreated person, but it is not highly contagious. In the past, people with leprosy were shunned from society and forced to live in colonies with other sick people as people were scared to catch it. Malaria. Malaria is a severe disease caused by a parasite transmitted through the bite of infected mosquitoes. The parasite travels to the liver, which multiplies before infecting and destroying red blood cells. Symptoms usually appear within 5 to 10 days after being bitten. Malaria is so effective at invading and killing red blood cells that scientists can't come up with a way of removing them from red blood cells without killing everything in your body. Malaria can also cause anemia, convulsions, and confusion due to the widespread destruction of red blood cells by the replicating malaria parasites inside them. If untreated, the parasite load in the blood continues to increase, leading to more severe complications as the parasite continues to invade and destroy any organ it can get a hold of. Anthrax. Anthrax is a bacterial infection caused by the spore-forming bacterium and could also be used as a biological weapon. Assuming you were a biological terrorist, you'd need only $9,000 to acquire the genome for anthrax spores, the lab, and materials to make your biological weapon right in the comfort of your home. Inhalation anthrax is the most severe form, typically caused by inhaling spores leading to severe respiratory symptoms. The infection spreads rapidly through the lungs and bloodstream, and as your body responds by sending its white blood cells to swallow it up, they've adapted to live inside your white blood cells. And just like the Alien movie, they burst out of your white blood cells. Rinse and repeat, and you have a body-wide catastrophe as the bacteria use your cells as fuel for its never-ending hunger until you die. And it's not over. The spores will wait for the next victim for years. However, thankfully, almost all cases are related to animals, for now. Polio. Polio, while not a funny topic, can be understood with humor. Imagine your body as a fortress with a moat, your spinal cord guarded by knights, your immune system. Polio is like a general sieging your castle. It's a virus that can swim through the moat, and when it successfully breaches the castle walls, your immune defenses, it causes lifelong and irreversible symptoms. It primarily affects children under the age of 5 and can lead to irreversible paralysis. Once it enters the body, the virus multiplies in the intestine, which can invade the nervous system and cause paralysis. However, the introduction of vaccines has significantly reduced polio cases worldwide. Tetanus. Tetanus is a bacterial infection and quite a severe disease that can affect anyone within the range of a rusty playground. Tetanus bacteria are often found in soil, dust, and manure, and the infection usually enters the body through open wounds or cuts. You'd prick yourself on the playground with a rusty nail and brush it off, but little do you know that an unwelcome guest has made itself home. Once inside the body, the bacteria releases a toxin that affects the nerves, causing muscle stiffness and spasms, particularly in the jaw and neck muscles. This can lead to difficulty opening the mouth and swallowing, which is why it's called lockjaw. The severity of tetanus can be life-threatening if left untreated, resulting in the complete locking of every muscle in position, leaving you in agonizing pain for hours without an end. Cholera. Cholera is a bacteria infection known for its rapid onset of severe diarrhea and dehydration, often leading to a life-threatening condition or death in less than 24 hours if not treated promptly. The bacteria are typically found in contaminated water sources or food, particularly in areas with inadequate sanitation and poor hygiene practices. When someone ingests contaminated water or food, the bacteria release a toxin in the intestines, which results in profuse watery diarrhea, vomiting, and leg cramps. It rapidly leads to severe dehydration, and without treatment, even large volumes of water consumption may not prevent the intense symptoms because the bacteria toxins make it so that you reasonably cannot physically hold anything in your stomach without severe vomiting. Mad cow disease. Mad cow disease is a bizarre example of animal disease that can transmit to humans by eating meat. Picture a serene pasture with content cows grazing peacefully, and then suddenly one cow starts behaving like it's lost its mind. If this crazy cow was supposed to be a brain cell, that was a well-oiled machine. Tiny protein cogs work together smoothly to keep the machine running and your brain functioning correctly. Now, picture a wrong cog that's gotten bent out of shape. This is like a prison. It doesn't fit right with the other cogs and throws the whole machine out of shape. Soon, the entire machine grinds to a halt, just like a prion-infected brain cell stops working correctly. In cows with mad cow disease, this malfunctioning happens in many brain cells, leading to spongy holes and a decline in brain function. That's why they might stumble, behave oddly, or even become aggressive. The scary part is that this rogue cog problem can be contagious. If you eat meat from an infected cow, the prion can jump into your brain and start twisting your cogs too. This is how humans can get variant Creutzfeldt-Jakob's disease, VCJD, the human form of mad cow disease. Creutzfeldt-Jakob disease, CJD. Creutzfeldt-Jakob disease, CJD, is a mysterious and perplexing puzzle in brain disorders like its cow counterpart. Again, imagine your brain as an intricate jigsaw where every piece has a specific role and place. CJD, however, is like that annoying puzzle piece that doesn't fit but insists on disrupting the entire picture. This condition is once again caused by misfolded proteins called prions. These prions act like troublemakers at a perfectly organized party, causing chaos and confusion. They convince other proteins in your brain to misfold, setting off a chain reaction of neurological mayhem. As it progresses, it also erases the parts of the puzzle. Memory loss, cognitive decline, muscle spasms, and personality changes blur the once clear image. The puzzle becomes increasingly disordered until communication and movement are lost entirely. Unlike a puzzle you can complete, there's no solving to CJD. It's a rare and devastating condition with no known cure, leaving healthcare professionals and researchers puzzled by its complexity and impact on the brain. Brain-eating amoeba. Naegleria fowleri, often called the brain-eating amoeba, is a microscopic organism that lurks in warm freshwater environments such as lakes, rivers, and hot springs. Imagine dipping in warm, natural water on a hot summer day. Most of the time, it's a delightful experience, but occasionally, if the conditions are just right, Naegleria fowleri might enter the nose. Once inside, it travels up the olfactory nerve and can cause an extremely severe brain infection. This amoeba's presence in the brain can lead to symptoms like severe headaches, fever, nausea, and a stiff neck, making it feel like a science fiction plot unfolding in real life. Unfortunately, PAM is typically swift and almost always fatal, with a meager survival rate. Familial fatal insomnia, FFI. Familial fatal insomnia is quite possibly the definition of a waking nightmare. A person slowly loses their ability to sleep, and as they do, their mind and body unravel like a chilling thriller. However, it is an exceedingly rare genetic disorder caused by a mutation in your genes. The nightmare begins with insomnia, which worsens over time, leading to a complete and irreversible loss of sleep. As sleep deprivation intensifies, patients experience hallucinations, delirium, and severe psychiatric symptoms, almost like something out of a surreal horror story. Ultimately, FFI leads to a total breakdown of the body's functions, resulting in death. Kuru. Kuru is a fatal brain disease causing neurological degeneration. However, one thing is added to the mix: cannibalism. In this one, Kuru emerged as a result of consuming the brains and nervous tissues of deceased relatives during their mortuary feasts. The name Kuru itself means to shiver or trembling in fear, which aptly describes the symptoms that would eventually haunt those who partook in this ritual. Victims would experience muscle tremors, loss of coordination, and a disturbing inability to control their movements. The end stages of Kuru resulted in a state of profound debilitation and death, often within a year of symptom onset. Perhaps another reason on the already long list of why eating people is a horrible idea. Rabies. Rabies is an illness caused by a virus that makes animals and people go rabid with symptoms such as uncontrollable bursts of rage, and is the most lethal disease on Earth. In this unsettling tale, the rabies virus is transmitted through the bite of an infected animal, infiltrating the nervous system and causing madness and terror. Once human symptoms appear, they're nothing short of a terrifying thriller. Fear of water, severe hallucinations, and violent spasms are just some of the horrifying effects. What's even scarier is that 98% of all rabies cases lead to a tragic end soon after symptoms appear, and once they do, it's nearly always fatal. Autobrewery syndrome. Autobrewery syndrome is a rare disease in which a person's body becomes an actual brewery, with no required beer-making equipment. Medical reports suggest fewer than 100 cases have been documented worldwide. It's like having a tiny alcohol distillery running inside you 24/7. The syndrome occurs when an overgrowth of yeast in the gut goes into overdrive, fermenting carbs and sugars a person consumes into ethanol, booze, brewing beer from the inside out. People with this condition can exhibit signs of drunkenness, like slurred speech and impaired coordination, without ever taking a sip. They could show up to work or class completely totaled but swearing they're 100% sober. In severe cases, dangerously high blood alcohol levels require medical treatment because constantly being brutiful on the inside takes its toll. Managing it involves starving the yeast of their favorite sugary ingredients. Mobius syndrome. Mobius syndrome is a rare condition that affects approximately 1 in 50,000 to 1 in 500,000 newborns. Children born with this syndrome have problems with their facial movements and expressions. Their faces may seem quite still or have very little movement and expression. This is because the nerves that control the facial muscles are not working correctly. The reason for this is not fully understood, but it is thought to be caused by something during pregnancy when the baby was developing in the womb. it's not something that can be passed down from parents to children. Children with Mobius syndrome often have trouble with simple things like smiling, frowning, or blinking their eyes. Their faces may appear quite flat or blank. They may also have difficulty with other movements like walking properly, gripping things, and moving their eyes from side to side or up and down. While there is no cure for Mobius syndrome, treatments are available to help with some of the symptoms. These can include things like speech therapy, physical therapy, or even surgery in some cases. Fibrodysplasia ossificans progressiva. It is estimated to occur in approximately 1 in 2 million individuals worldwide, making it one of the rarest genetic conditions known. The body develops bones in abnormal places like muscles, tendons, and other connective tissues. Imagine your body getting confused and turning those soft tissues into rock solid. It starts in childhood with kids developing malformed big toes. As they grow older, any minor injury or overuse of muscles can trigger new bone formation. Over time, this extra bone locks up their movement, making it difficult to move around freely. There's no cure yet, but avoiding injuries is key to preventing rapid worsening. Even falling, getting immunizations, or doing dental work can spark new bone growth flare-ups. Progeria syndrome. Progeria is a very rare genetic condition that causes premature aging in kids. Kids with progeria look like typical newborns, but around 1 year old they start aging rapidly. It affects around 400 children worldwide at any given time, roughly 1 in 20 million people. Their skin becomes thin and wrinkled, their hair falls out, and their bodies don't grow as they should. Instead of growing taller, their bodies also age faster on the inside. This accelerated aging strains their hearts, blood vessels, and other organs. This rapid aging is caused by a faulty gene that makes an abnormal protein. This protein messes with the inside of cells, like having a tiny wrench in your bike gears. But this wrench causes your gears to age 50 times faster than usual. The life expectancy for individuals with progeria is tragically short, as it is incurable. Most children with progeria live to an average age of about 13 years, with the majority of deaths occurring from complications of atherosclerosis, hardening of the arteries, such as heart attacks or stroke. Ondine's curse. Ondine's curse is a genetic disorder estimated to occur in approximately 1 in 200,000 to 1 in 1 million live births, where the brain forgets to tell the body to breathe normally. Babies born with this seem perfectly healthy at first, but soon after birth, their brain stops sending the right signals to the muscles that control breathing. This means they can't automatically breathe properly while sleeping or unconscious. Their bodies don't automatically respond as strongly to rising carbon dioxide levels in the blood, the usual trigger to breathe. Despite this challenge of consciously remembering to breathe, many children with Ondine's curse can grow up, attend school, and be active thanks to modern ventilation equipment and their family's dedication. Fish odor syndrome. Fish odor syndrome is a metabolic disorder that causes those affected to give off an unpleasant fishy or rotting odor. The odor comes from an excessive buildup of trimethylamine, a chemical compound that has a fishy smell. Our bodies normally convert this compound into another odorless form before excreting it. However, in people with fish odor syndrome, there is a deficiency in the enzyme needed to break down trimethylamine properly. As a result, this fishy-smelling chemical accumulates and gets released in a person's sweat, urine, reproductive fluids, and breath, giving off a potent trimethylamine odor reminiscent of rotting fish. Treatment usually involves restricting foods high in nutrients that produce trimethylamines, like eggs, legumes, and some fish. Supplements, antibiotic drugs, or activated charcoal may also help manage episodes when the odor flares. Erdheim-Chester disease. Erdheim-Chester disease, ECD, is an extremely rare genetic disease where abnormal cells start growing excessively in different tissues and organs of the body. Around 1,500 cases have been documented worldwide since the disease's discovery. It's not cancer, but these cells can clump together forming masses or lesions. It throws a wrench into your immune system by overproducing these warrior cells called histiocytes. Normally, histiocytes are like bodyguards, patrolling tissues and mopping up invaders. But in ECD, they multiply out of control. These extra histiocytes become unwanted travelers traveling to different organs. This unwelcome invasion can thicken tissues, damage organs, and cause many symptoms depending on where they decide to squat. ECD can affect your bones, making them painful and dense, or mess with your skin, lungs, heart, or brain. Blue rubber bleb syndrome. It's a condition where people are born with rubbery, blue/purple raised growths or lumps on their skin and inside their bodies. These abnormal growths are called rubber blebs. The total number of reported BRBS cases is around 200 worldwide. The blebs can appear anywhere on the skin. Some are just small marks, while others are large, disfiguring bumps. But the biggest concern is when these malformed blood vessel growths develop internally in the intestines, lungs, or brain. These internal rubber blebs can bleed or rupture, leading to serious bleeding issues. Intestinal bleeding from growths in the gut is one of the main problems faced by those with this. The blebs are present from birth, but may only be apparent once they gradually increase in size and number as the person ages, sometimes only in adolescence or adulthood. Paraneoplastic pemphigus. It's an autoimmune disease, which means the body's immune system mistakenly attacks healthy tissues. In this case, it targets proteins that hold skin cells together, causing painful blisters. But it has an even bigger issue. It's almost always linked to an underlying cancer, like lymphoma or leukemia. It's like a two-pronged attack. The body fights itself and a hidden enemy simultaneously. The most obvious sign of PNP is widespread blistering on the skin and mucous membranes, like the mouth and genitals. It can also wreak havoc on internal organs, especially the lungs. This can lead to serious breathing problems. Diagnosing PNP can be tricky because it shares symptoms with other blistering diseases. Doctors looking for clues like the blistering pattern may run tests to rule out other causes and potentially identify the underlying cancer. Unfortunately, there's no single cure for PNP. Treatment focuses on managing the blisters with medications and immunosuppressants while also tackling the underlying cancer if possible. Stufe-Wiedemann syndrome. Stufe-Wiedemann syndrome, SWS, is a serious genetic disorder affecting bone development and the body's control system. It disrupts bone development, causing bowed long bones and limited joint movements. On top of that, it messes with the autonomic nervous system, which controls involuntary functions like breathing, temperature regulation, and heart rate. Symptoms of SWS are usually apparent from birth. Infants with SWS will have characteristic skeletal features and struggle with breathing, feeding, and maintaining a normal body temperature. Their bones are dense and malformed, especially in the long bones. Sadly, it is often fatal in infancy or early childhood. However, early diagnosis and proper medical management have significantly increased survival rates. Many people with SWS can now live into adolescence or even adulthood. Neurofibromatosis type 1. Neurofibromatosis type 1, NF1, is a genetic disorder that primarily affects the growth and development of nerve cells. NF1 can lead to the formation of tumors called neurofibromas, which can grow along the nerves throughout the body, leading to massive growths all over the body. These tumors can cause various symptoms depending on their location and size. Some common manifestations include skin discoloration, freckling in the armpit or groin area, and the development of soft, fleshy growths on or under the skin. In some cases, NF1 can also result in complications such as learning disabilities, bone deformities, and an increased risk of certain types of cancers, particularly brain tumors and malignant peripheral nerve sheath tumors. Treatment for NF1 is primarily focused on managing the symptoms and complications associated with the condition. People with this often develop multiple brain tumors throughout their life, meaning they need brain surgery almost every year if severe. Cystic fibrosis. Cystic fibrosis, CF, is a genetic disorder primarily affecting the respiratory and digestive systems. In people with this, the body produces thick, sticky mucus that accumulates in various organs, particularly the lungs and pancreas. This mucus buildup can cause respiratory problems such as frequent lung infections, breathing difficulties, and lung damage, meaning you would choke on your own fluids if left untreated. The thick mucus can obstruct the pancreatic ducts in the digestive system, preventing the release of digestive enzymes necessary for proper nutrient absorption. As a result, individuals with CF often experience malnutrition, poor growth, and vitamin deficiencies. Perhaps cruelly, more often than not, individuals with this disease can't be in close contact with other people, as you would risk cross-contamination of bacteria in one lung jumping to another. Treatment for CF typically involves a comprehensive approach to manage the symptoms and complications. This may include breathing treatments to help clear mucus from the lungs, antibiotics to treat lung infections, enzyme supplements to aid digestion, and specialized nutritional support. Duchenne muscular dystrophy. Duchenne muscular dystrophy is a severe genetic disorder that primarily affects boys and leads to progressive muscle wasting and weakness. When the gene responsible for ensuring proper muscle growth is absent or defective, muscle fibers become prone to damage and gradually deteriorate over time. The common issue is the progressive weakening of skeletal muscles, which often start in early childhood. The muscles closest to the body's trunk, such as those in the shoulders, hips, and thighs, are affected first. This results in difficulty climbing stairs, rising from a seated position, and raising arms above the head. This worsens, and the affected muscles waste away even faster as the disease progresses. This muscle wasting occurs due to the ongoing cycle of muscle fiber damage and inadequate repair. As the disease advances, the muscles responsible for breathing, including the diaphragm and intercostal muscles, become affected. This can lead to respiratory complications and the need for assisted ventilation. There is no cure for this, and eventually the body wastes away and the person is left fully dependent on support. Sneeden syndrome. Sneeden syndrome is an extremely rare disorder that involves two very unusual conditions occurring together: widespread recurring livedo rash and recurring strokes, even in young patients. The livedo rash appears as a purplish discoloration on the skin, especially on the arms and legs. It comes and goes, but never fully goes away. Poorly formed small blood vessels under the skin cause this rash. More concerning are the strokes these patients experience at a young age, often before 45 years old. The strokes are ischemic, meaning they occur when blood flow is blocked to parts of the brain. In Sneeden syndrome, the strokes are believed to be caused by the same blood vessel problems that lead to the livedo rash: inflamed and clotted small blood vessels. There is no cure, but treatment aims to prevent further strokes by thinning the blood and suppressing the abnormal clotting process. Dancing plague. The dancing plague was the first and last of its kind and began in July 1518 in Strasbourg when Mrs. Trophia started dancing in the street. Within a week, she was joined by dozens of others, and within a month, the number had swelled to around 400 people. The dancers seemed to be in a trance-like state, unable to stop or rest even after days of continuous dancing. Many of them eventually danced themselves to death from exhaustion, heart attacks, or strokes. The authorities of Strasbourg tried various methods to stop the plague, including hiring musicians and opening dance halls, but nothing seemed to work. Historians and scientists have proposed various theories to explain the dancing plague of 1518, including mass hysteria, psychological distress, ergot poisoning from contaminated rye grain, or religion. Ergotism, not a widespread disease as it was then due to better sanitation and hygiene, but if you were a medieval peasant who just so happened to eat the wrong piece of bread at the wrong time, you were in for one hell of a ride. Ergotism is a severe condition caused by ingesting toxins from the ergot fungus, which grows on rye and other cereal grains. Ergotism outbreaks frequently occurred in the Middle Ages before modern food storage and milling practices. Damp storage conditions allow the ergot fungus to multiply on grain supplies. Consuming ergot-contaminated rye or rye products exposed populations to the toxins. Due to severely restricted blood flow, it caused intense burning, cold sensations, and rotting of the extremities like fingers, toes, ears, and nose. The affected areas turn dark and die, sometimes requiring amputation. This disease was sometimes historically misinterpreted as bewitchment, and some people would be hanged on the belief they were wizards or witches. Cholera. Nothing ever said Victorian England like coal mines, starving children, and Vibrio cholera. Cholera is a diarrheal infection caused by the bacterium Vibrio cholerae. It was usually acquired by ingesting food or water contaminated with the bacterium. The main route of cholera transmission is fecal contamination of water sources used for drinking or food preparation. Overcrowded conditions with poor sanitation of times, like in England in the 19th century, gave the bacteria insane numbers of the population to infect. A 2-year outbreak caused a devastating impact, claiming an estimated 52,000 lives across England and Wales. In London, it was the worst outbreak in the city's history, with a death toll exceeding 14,000. Cholera is a significant issue in poorly developed countries. Cholera causes profuse, watery diarrhea, vomiting, and rapid dehydration. If untreated, severe fluid depletion can lead to shock and death within hours. The relentless diarrhea and vomiting quickly cause rapid visible dehydration. The patient's eyes become sunken, their mouths dry out completely, and intense thirst sets in as their body desperately tries to replace fluids. Their skin may take on a shriveled, tinted appearance when pinched due to lack of elasticity from fluid loss. As dehydration worsens, the patient's blood pressure drops dramatically due to the depleted fluid volumes in the bloodstream. This shock puts extreme strains on the organs. Without intervention, the skin may turn bluish as vital organ systems fail due to a lack of blood flow and oxygen. Death would often happen in 24 hours if left untreated with IV fluids and antibiotics. Typhoid fever. Mary Milan, better known as Typhoid Mary, was an asymptomatic carrier of typhoid fever in the early 20th century. Mary Milan was a cook for wealthy families in New York in the 1900s. Despite showing no signs of illness herself, she spread the deadly typhoid fever bacteria to dozens of people she served food to. The typhoid fever would begin gradually with fatigue, weakness, stomach pains, and a mild fever. The fever becomes very high as the illness progresses over the following weeks, potentially reaching 104 degrees Fahrenheit or higher. As the disease progresses without treatment, patients may experience a range of severe symptoms, including delirium, mental fog, and extreme fatigue, sometimes advancing to a stupor. Moreover, untreated infections can cause gastrointestinal bleeding, manifesting as bright red or maroon stools, a direct consequence of intestinal ulcerations. Yellow fever. Yellow fever gets its name from one of the most distinctive and recognizable symptoms it can cause: jaundice, which gives the skin and whites of the eyes a yellowed appearance. When major yellow fever outbreaks occurred in the Americas in the 18th and 19th centuries, this apparent yellow skin discoloration became an unmistakable sign of the deadly disease for doctors, with fatalities estimated to range from 100,000 to 150,000 deaths. Yellow fever begins with a sudden onset of fever, chills, severe headache, muscle and body aches, and a general feeling of illness. The fever climbs rapidly, potentially reaching as high as 105 degrees Fahrenheit. Patients become tired and weak, losing their appetite and feeling nauseous. After several days of high fevers and flu-like symptoms, many experience a brief remission, during which the fever subsides and they feel somewhat improved, though still exhausted. However, this would often be a cruel lie, as around 15% of patients then enter a more toxic phase within a day. In the toxic phase, the fever returns with a vengeance and can spike even higher than in the initial stage. The high fever, combined with dehydration from vomiting, abdominal pain, and an inability to take in fluids, leads to rapid deterioration. The skin and eyes may take on a distinctive yellow jaundiced hue as liver damage advances, giving the disease its name. As yellow fever progresses, bleeding problems emerge, with blood appearing in vomit, the oral cavity, eyes, and other orifices. Liver and kidney failure set in with decreased urination. Before modern treatments, the majority of those entering the toxic phase would die due to the rapid multi-organ deterioration within 2 weeks of the initial symptoms. River blindness. River blindness is a parasitic disease transmitted through the bites of infected black flies. These flies breed in fast-flowing rivers and streams, hence the term river blindness. Once infected black flies bite humans, they deposit the larvae of Onchocerci volvulus under the skin. These larvae develop into adult worms, which can live for up to 15 years in the human body. The adult worms produce millions of microscopic larvae, which migrate through the skin and other tissues. When the microfilariae die, they trigger an inflammatory response leading to severe itching, skin lesions, and eventual blindness. The biggest symptom of river blindness is severe itching, which can be debilitating and often leads to scratching, causing skin damage and secondary bacterial infections. Over time, repeated exposure to the parasite can lead to irreversible eye damage and blindness, hence the name river blindness. River blindness primarily affects rural communities in sub-Saharan Africa, particularly in regions where black flies breed near fast-flowing rivers and streams. The disease is closely linked to poverty and limited access to healthcare, as affected populations often lack resources for preventative measures and treatment. Dysentery. The severity of yellow fever can be grasped by the fact that even American soldiers, known for their bravery in facing musket fire, referred to it with dread as Bloody Christ and a putrid monster. The illness's impact on colonial America cannot be overstated. It killed thousands in horrific and painful ways. Dysentery is an intestinal inflammation caused by bacteria or parasites, leading to frequent mucus passage and bloody stools. For early American settlers and troops, poor sanitation and contaminated food and water supplies allowed dysentery to spread rampantly. The symptoms began with griping, abdominal cramps, and tenderness in the lower belly as the intestinal lining became inflamed. This progressed to agonizing straining and the urgent need to defecate persistently. However, instead of providing relief, each bowel movement produced severe abdominal pain and the discharge of bloody mucus-filled stools. The disease was quite literally shredding your insides, and you were forced to watch in agony as all you could do was hope you were part of the 40% who would survive without modern medicine. As dysentery wore on, those infected endured constant fatigue, dehydration, fever, nausea, and vomiting from the relentless expulsion of fluids. The gut-wrenching cramps, chills, and painful straining could last for weeks or months. Severe cases caused the body to become thin as it wasted away. Scurvy. Unlike other diseases, the lack of simple vitamin C caused this. However, it didn't just affect anyone, because as long as you lived on land, your body would naturally crave what it lacks, like fruits and vegetables. Sailors afflicted by a particular disease endured prolonged periods at sea with a limited diet consisting mainly of hardtack biscuit bricks and salted beef jerky, so they barely had any source of the vitamin. Without this essential nutrient, the body cannot correctly produce collagen, a vital protein that binds cells together. This leads to a breakdown of connective tissues. The initial symptoms began with general weakness, feeling tired, and unusual bruising on the skin. As scurvy progressed further, psychological changes set in, like feeling depressed and unmotivated. In the advanced stages, hemorrhages would cause further bleeding from virtually any area. Under the skin, in the eye sockets, from the nose, mouth, old scurvy sores, and other orifices. The pain became severe and constant. Fever, nerve damage, jaundice, and eventual heart failure made scurvy inevitably fatal if untreated. On long ocean voyages before the 1800s, sailors and explorers were completely susceptible when their stored provisions ran out of vitamin C. Scurvy decimated entire crews, disabling ships at sea. Vasco da Gama lost 116 of 170 men to scurvy during his voyage, and the British Anson lost over 600 of 900 sailors to scurvy in 1741. Guinea worm disease. Guinea worm disease is a parasitic infection caused by the roundworm. It's transmitted when people drink water contaminated with water fleas, cyclops, that carry the larvae of the guinea worm. Once ingested, the larvae mature and mate in the human host's abdomen. The female worms, which can grow up to 2 to 3 feet in length, then migrate to the skin's surface, usually on the lower limbs, creating painful blisters. When the blisters burst, the worm releases its larva into the water, perpetuating the cycle. Guinea worm disease is not usually fatal, but can cause painful symptoms, including fever, nausea, vomiting, and intense pain. The worm's emergence from the skin can also lead to secondary bacterial infections and long-term disability. The disease primarily affects rural communities in parts of Africa, particularly those with limited access to clean drinking water and proper sanitation. Efforts to control guinea worm disease have focused on providing clean drinking water, educating communities about prevention measures such as filtering drinking water and preventing infected individuals from entering water sources, and implementing surveillance and contaminant measures to interrupt the transmission cycle. As a result of these efforts, guinea worm disease has been significantly reduced, with a dramatic decrease in the number of reported cases over the past few decades. Gout. Gout is a form of arthritis with sudden and severe attacks of pain, redness, swelling, and tenderness in the joints, most commonly affecting the big toe. It is caused by the accumulation of urate crystals in the joints due to high uric acid levels in the blood. Gout primarily affected large feudal lords who consumed red meat and alcohol daily, unlike peasants. High purine foods and drinks such as organ meats, seafood, and sugary beverages elevate uric acid levels, causing gout. Uric acid is a waste product that forms when the body breaks down purines, which are substances found in certain foods and beverages. Usually, uric acid dissolves in the blood and is excreted from the body through urine. However, if the body produces too much uric acid or the kidneys cannot eliminate enough of it, urate crystals can accumulate in the joints, triggering gout attacks. Gout attacks often occur suddenly, typically at night, and can be extremely painful, with the affected joint becoming swollen, hot, and tender to the touch. The pain and discomfort can be debilitating, making it difficult to walk or even stand. Cotard syndrome, a disorder where those affected believe they are dead, don't exist, or have lost their blood or internal organs. It is also sometimes called walking corpse syndrome. With Cotard syndrome, you'd often experience severe depression with delusions. The main delusion is an extreme belief that they or parts of their body are dead, rotting away, or do not exist. Some people think they have lost their soul or vital essence. They may try to throw out their possessions, stop eating and drinking, or even try to disprove their existence by injuring themselves without pain. Some feel immortal. Some lose interest in and withdraw from loved ones because they no longer believe they or their family is real. Munchausen syndrome. Munchausen syndrome is where a person repeatedly and deliberately acts as if they have a physical or mental illness when in reality they are not sick. People with this condition make up or exaggerate illnesses, seeking endless tests, procedures, and hospital stays, seeking the attention sick people usually receive. This often involves obsessive research on medical conditions and procedures, leading to anxiety and distress when their fabricated illness is questioned. Weirdly enough, they experience relief and satisfaction from gaining medical attention and sympathy, even if it comes at the cost of unnecessary medical activity and potential harm to their health. Bulimia nervosa. Bulimia victims often experience episodes of binge eating, during which they consume large quantities of food in a short period, feeling a loss of control over their eating behavior. Following a binge, they feel intense guilt, shame, and disgust about their eating habits and body shape. To cope with these feelings and the fear of weight gain, individuals with bulimia engage in purging behaviors, such as making themselves vomit, misuse of laxatives, or excessive exercise. It's a disorder that consumes thoughts, emotions, and relationships, leaving individuals feeling isolated, ashamed, and overwhelmed. Oppositional defiant disorder. This is mostly a disorder diagnosed in children. Children with oppositional defiant disorder show a pattern of uncooperative, defiant, and hostile behavior toward friends, parents, teachers, and other authority figures. They are more troubling to others than they are to themselves. A parent may ask a child to clean their room, and instead of simply, "Okay," there's an instant response, a rude look, and maybe even some stomping of feet. It's not just about being difficult, it's a response that feels almost automatic. In a way, it's like having a rebel without a pause button. It's not just about challenging rules, it's a whole mindset, a way of interacting with the world that's characterized by defiance, stubbornness, and a persistent refusal to toe the line. Olfactory reference syndrome. People with this have a fixed belief that they emit a foul odor, despite no evidence. This belief leads to obsessive worry and distress, causing them to engage in repetitive behaviors like excessive showering or social avoidance. Individuals may constantly check themselves for any sign of odor, repeatedly shower or change clothes, and excessively use perfumes or deodorants in an attempt to mask the perceived smell. Due to the fear of being judged or ridiculed because of their perceived odor, individuals with olfactory reference syndrome may avoid social interactions, leading to isolation and loneliness. Fragile delusion. It's when a person holds the delusional belief that different people are a single person who changes appearance or is in disguise. People who have this delusion believe that everyone they see is just one person posing as others. For example, they may think a stranger is a friend of theirs in disguise, or that various people they encounter are the same person transforming their look. Those suffering from the fragile delusion often believe the perceived single person is hurting them and out to get them. They may think people they know are merely actors. Their delusional belief makes them extremely suspicious of others and compels them to search for proof of their belief. Body dysmorphic disorder. Body dysmorphic disorder, BDD, is a condition marked by an obsessive fixation on imagined flaws or minor imperfections in one's appearance which are typically insignificant to others. Individuals with body dysmorphic disorder excessively focus on specific aspects of their appearance, such as their skin, hair, nose, weight, or body shape, believing that these features are flawed or abnormal. Mirrors become both a source of torment and a constant reminder of how ugly they are. They may spend hours judging their appearance, engaging in rituals to hide or fix these flaws, and comparing themselves unfavorably to others. Agoraphobia. Agoraphobia is an anxiety disorder with an intense fear of being in situations where escape might be difficult or help is unavailable. People with agoraphobia often fear and avoid situations like public transportation, enclosed spaces like movie theaters, and open spaces like parking lots or bridges. The fear is driven by worrying about having panic-like symptoms or embarrassing symptoms in these settings. People with agoraphobia may fear they won't be able to easily exit or get help if symptoms occur. As a result, they avoid situations where escape seems difficult. In severe cases, the person may become unable to leave their home altogether. Borderline personality disorder. It is a mental health condition that has difficulties with emotion regulation, impulse control, and personal relationships. People with this disorder often feel emotions very intensely. Their emotions tend to shift frequently, sometimes rapidly cycling between sadness, anger, emptiness, and anxiety. Small triggers can provoke disproportionate emotional reactions. Impulsive behaviors are common in people diagnosed with this disorder. This may include reckless spending, substance abuse, binge eating, and even self-harm. These impulses are often coping mechanisms to deal with painful emotions. Diogenes syndrome. Diogenes syndrome is a disorder that affects older adults. It occurs usually mainly in older men. The main symptoms are excessive hoarding, dirty homes, and poor personal hygiene. People with Diogenes syndrome also withdraw from life and society. They often live alone and are unaware that anything is wrong with the condition of their home and lack of self-care. They display extreme self-neglect in terms of hygiene and appearance. They may look extremely dirty with long fingernails, dirty clothes, and greasy hair. Lacking shame or concern for social norms, they may urinate or defecate anywhere in their home, remain naked, or demonstrate other taboo behaviors. Weirdly enough, the home becomes a refuge and a prison, a place where belongings pile up unchecked and basic hygiene and cleanliness are neglected. Rooms become filled with newspapers, trash, and belongings stacked to the ceiling, creating an overwhelming and hazardous environment. Trichotillomania. It involves frequent, repeated, and irresistible urges to pull out hair from your scalp, eyebrows, or other areas of your body. People who have this disorder may try to resist the urges, but they can't stop it. Now, we all tweeze stray eyebrows or pull split ends now and then, but for those with trichotillomania, hair removal becomes excessive, even to the point of noticeable bald patches on the scalp or eyebrows. Those with it may initially feel a tingling or itching before giving in to the urge to pull. Some describe entering a trance-like state while engaging in the hair removal ritual. The urge and resulting hair pulling can happen during times of both stress and boredom. Dissociative identity disorder. It's when someone has multiple distinct personalities sharing the same body, often as a coping mechanism from trauma. Imagine having different versions of yourself taking turns interacting with the world. Interestingly, once it's your turn to be back in control, you have no memory of what your other personalities did. Those affected often experience memory loss between personality states and may feel like they have been taken over by other identities. These alternate identities are referred to as alters. Alters can have different ages, genders, personalities, and voices. Switching between alters is often triggered by psychological stress. The person may transition rapidly between identities in a matter of seconds. Hypochondria. Imagine living with a constant, overwhelming fear of having a serious medical condition despite reassurance from doctors and negative test results. Every minor ache, pain, or bodily sensation becomes a cause for alarm, triggering a lot of catastrophic thoughts about potential illnesses or diseases. This paranoia and anxiety can lead to frequent doctor visits, extensive medical tests, and a constant need for reassurance that provides only temporary relief. People with hypochondria tend to misinterpret minor body symptoms and sensations as signs of a horrible disease, even when medical evaluation finds no evidence. Examples include interpreting a headache as a brain tumor or seeing a small mole as skin cancer. Derealization disorder. This disorder occurs when a person often feels that they're seeing themselves from outside of their body or sense that things around them are not real, or both. They may feel like they're living in a dream. Sufferers describe sensations of feeling detached from their own emotions, senses, and personalities. They may feel groggy, dreamlike, or as if they're just going through the motions of living. The sense of detachment can extend to friends and family who may seem unfamiliar. They might look in the mirror and feel like the person staring back at them isn't quite them, or they might see things happening around them, but it feels like they're not a part of it, almost like watching a TV show instead of living in the moment. Dissociative amnesia. Dissociative amnesia isn't about simply forgetting things. You experience gaps in your memory, like missing pieces of a puzzle from your life. This is what people with dissociative amnesia face. They experience an inability to recall important personal information often related to traumatic or stressful events. They experience sudden and unexpected memory loss. This can involve forgetting specific events, periods, or even personal details like their identity. Possible causes are usually severe emotional trauma, hence it becomes a protective mechanism. The mind may unconsciously block out traumatic memories as a way to cope with overwhelming emotional pain. Dermatillomania. Dermatillomania is being trapped in a relentless cycle of compulsion and shame. Imagine feeling an irresistible urge to pick at your skin, whether it's a blemish, a scab, or an imperfection, despite knowing that it will lead to damage and potential scarring. The face, arms, and hands are most commonly picked at, but any body part can be affected. Skin picking is done in response to negative emotions, stress, or boredom, and can provide a temporary sense of relief or satisfaction. Those with dermatillomania may pick skin for lengthy periods without realizing it, and attempts to stop picking are usually unsuccessful. The cycle of picking and healing can lead to physical discomfort, skin infections, and long-term scarring, further fueling feelings of distress and shame. Erotomania. Erotomania is a form of behavioral disorder in which an individual has an unfounded belief that another is in love with him. Previous case reports have shown that social media networks may play a role in worsening delusional beliefs. Erotomania is living in a world where reality blurs with fantasy and the lines between admiration and obsession become dangerously thin. The person with this disorder feels convinced that someone, often a public figure or someone of higher status, is deeply in love with them despite little or no evidence to support this belief. Individuals with erotomania may interpret innocent gestures or coincidental encounters as proof of the other person's undying love, leading to persistent attempts to make contact, declarations of affection, or even stalking behavior. Despite the lack of the same feelings from the object of their affection, individuals with erotomania may experience intense emotional highs and lows, further fueling their delusional beliefs. Sleeping sickness. This parasitic disease is transmitted by the bite of infected tsetse flies in sub-Saharan Africa. The hallmark symptom is, as you can probably guess, sleeping, but not one that you wake up from, but rather one that has the risk of putting you in a potentially irreversible coma if left untreated. Let's say that after a long year, you and your family were to book a safari in Africa going through the jungle, and in the heat, you don't notice the random tsetse fly biting you. Sure, it's a painful bite, but you've been bitten by annoying bugs before, so you don't pay attention. A few days later, your first symptoms would appear as pretty common symptoms of fever, headache, joint pain, and itching at the site of the tsetse fly bite. The parasites move from the initial site of the tsetse fly bite to the bloodstream, eventually penetrating the blood-brain barrier and protecting the brain from harmful substances. Once inside the central nervous system, the parasites cause inflammation and damage to brain tissue, particularly in the regions responsible for regulating sleep patterns. Disrupting the sleep-wake cycle can lead to various sleep disturbances, including excessive daytime sleepiness, insomnia, confusion, and changes in the sleep cycle. If untreated, sleeping sickness can lead to severe neurological damage, coma, and death. You'd be safe from contracting this by avoiding being bitten by tsetse flies, which transmit the disease, wearing protective clothing and using insect repellents, and avoiding entering tsetse fly-infested areas, especially when the flies are most active at night. Marburg virus disease. Another gift from the Ebola family that keeps giving, and as Ebola's second cousin, it's less well known, but just as deadly. Marburg virus disease is a highly infectious and potentially deadly illness that is recognized almost instantly by its scariest symptom, massive bleeding from every opening in your body. The virus is transmitted through direct contact with infected individuals or animals' bodily fluids, such as blood, saliva, or other secretions. As the disease progresses, things may be pushed into third gear. As the body is overwhelmed by the number of viruses, it throws everything at it and unleashes its last resort, a cytokine storm. Normally, cytokines are produced by the immune system to help fight off infections. However, in a cytokine storm, the immune system goes into overdrive and releases an overwhelming amount of cytokines into the bloodstream. A cytokine storm is essentially the immune system overreacting and damaging the body's cells and tissues instead of fighting off the infection or threat. It's like calling in an excessive amount of reinforcements that end up destroying the city they were trying to protect. The body then begins to bleed massively, both internally and externally. You die from literally both drowning and losing your blood. Since the virus was first identified in 1967, a few dozen outbreaks have been reported, primarily in Africa. The largest outbreak occurred in Angola in 2004 to 2005 with over 200 cases and a mortality rate of around 90%, meaning you'd stand a 9 in 10 chance of dying from this. Nipah virus infection. The infection of the Nipah virus is a highly dangerous viral disease because of its unique features. Unlike other viruses, its natural host is in fruit bats, which is rare as it shows how viruses easily emerge and spread from animals to humans. Nipah virus, with its high mortality rate ranging from 40% to 75%, makes it one of the deadliest viruses to jump species. Upon your unlucky infection, one of the scariest symptoms you'd most likely develop is encephalitis, a brain inflammation. The virus can cross the blood-brain barrier, a wall protecting your brain, and directly infect the brain tissue. As your brain swells, the extreme pressure caused by the infection causes you to experience severe headaches, drowsiness, disorientation, mental confusion, and altered consciousness. As the condition progresses, you may even fall into a coma. Even if you were lucky enough to get rid of the virus, the damage caused by the virus can often be irreversible. The virus can lead to the destruction of brain cells, causing significant neurological deficits in those who survive the infection. Survivors may suffer from long-term neurological issues including persistent convulsions, personality changes, and reduced brain function. Elephantiasis. Elephantiasis is a disfiguring disease that shows the extreme lengths some parasites will go to exploit the human body. The root cause of elephantiasis is parasitic worms, which infiltrate the human lymphatic system. If you think these thread-like parasites slithering through one's lymph vessels is unsettling, you will be horrified by what they do. What makes this even more unsettling is how these parasites are transmitted, through mosquito bites. The mosquito is an unwitting delivery vehicle passing microscopic worm larvae into a person's skin during a seemingly innocuous blood meal. Once inside, the worms co-opt and wreak havoc on the vital lymphatic drainage system, a system in the body that carries immune cells over many years. As they grow, mate, and die, their presence triggers a horrific inflammatory response that progressively scars and obstructs the lymph vessels, causing massive lymphatic issues. The signature manifestation is the most disturbing. The parasite's sabotage of the lymphatics lead to relentless massive swelling of the limbs, genitals, or breasts into huge dimensions due to fluid accumulation. These severe disfigurements give the disease its foreboding name after the swollen, thick limbs like an elephant's leg, with no exaggeration. Even if treated, victims can be left permanently disfigured with massively swollen, heavy limbs susceptible to repeated infections, leaking of lymph fluids, or inability to use the affected body parts usually ever again. Flesh-eating disease. True to its name, the flesh-eating disease particularly likes the soft tissues on your skin surrounding important muscles, nerves, and blood vessels because the bacteria release toxins that can destroy tissue and lead to rapid tissue death. Necrosis. Within a day or two of initial simple symptoms, the infection can start aggressively digesting skin, fat, and muscle tissue at insane rates, sometimes several inches per hour. This explosive spread of necrosis is utterly bizarre. While the infection may enter through even minor cuts, no part of the human body is spared once it takes hold. Necrotizing bacteria can rapidly travel along tissue planes, methodically killing cells and liquefying flesh as they ruthlessly spread up limbs, across torsos, and into vital organs. In a race against time, the only way to stop tissue destruction is through urgent surgery to cut away and remove every last inch of infected and decaying flesh, often requiring amputation of limbs, removal of skin, or disfiguring surgeries. Essentially, the body willingly sacrifices part of itself to survive. Even then, the battle isn't over. As bacteria furiously consume body tissue, they release toxins into the bloodstream that can send the body into a fatal spiral of organ failure, fever, low blood pressure, and toxic shock. Hepatitis B. The hepatitis B virus, unlike other viruses, is remarkably resilient and can survive outside the body for at least 7 days, with viruses like HIV lasting only a few hours. This allows indirect transmission through contact with contaminated surfaces, unlike most viruses that require direct person-to-person spread. Its ability to linger in the environment makes it one of the most contagious human viruses. In some cases, hepatitis B establishes a persistent chronic infection that can last decades. The virus can silently attack the liver for years or even a lifetime without causing notable symptoms initially. This invisible, slowly destructive nature makes it highly dangerous compared to acute viral illnesses that at least show symptoms. Hepatitis B has evolved clever ways to hijack the human liver cells and use them as virus factories. It can integrate its genetic material into the host's DNA, indefinitely hijacking the cell's machinery to pump out viral proteins and particles. Perhaps the most exciting aspect is that the virus can form a reservoir by persisting in some people's blood and body fluids for the rest of their lives, even without symptoms. These silent carriers can unknowingly spread hepatitis B through mucous membrane exposure. Long-term consequences is what makes hepatitis B so dangerous. chronic infection significantly increases the risk of eventual liver failure, cirrhosis, and even liver cancer decades down the line due to persistent inflammation and damage to liver cells. However, if vaccinated early enough, you can avoid infection even when exposed. Herpes. Herpes is a viral infection caused by the herpes simplex virus, HSV. Perhaps a not-so-fun fact is that it is estimated that almost half of the world's population has oral herpes. This means there's a pretty good bet that 1 in 2 people you meet every day has herpes. The good news is that despite being infected, almost all cases are mild cases of occasional flu-like symptoms. Herpes is typically associated with oral herpes, which causes cold sores or fever blisters around the mouth and face. Yes, that's right, the flu that your classmates have once in a while that causes them to get small wounds around their mouth is probably herpes. However, in a few cases where your immune system gets suppressed, the virus can spread from the initial site of infection and circulate throughout the body via the bloodstream. This can lead to herpes lesions erupting over widespread areas of skin. Genital herpes in pregnant women allows the shocking possibility of the virus crossing the placental barrier to infect fetuses, which can result in severe birth defects like blindness, brain damage, or even death for the newborn. While there is no cure for herpes, antiviral medication can help manage symptoms, reduce the frequency and severity of outbreaks, and lower the risk of transmitting the virus to others. Depending on the severity of the infection, these medications are available in oral, topical, and IV forms. Syphilis. It is a sexually transmitted disease that was largely incurable before penicillin and caused extreme disfigurement to many of Europe's royals in the medieval period, including Ivan the Terrible and several Spanish Habsburgs like Juan de Calabazas, whose eroded nose and disfigurement earned him his nickname, Jack of the Gourds. It progressed through stages, each more destructive than the last if left untreated. In the primary stage, a single sore known as a canker develops on the genitals or around the mouth. Other symptoms like fever, swollen lymph nodes, weight loss, and patchy hair loss may occur. This temporary false hope extends to the deadly latent and tertiary stages years or decades later. As the bacteria slowly spreads, soft tumor-like growths form under the skin and on bones. These swell up into thick reddish-brown sores. If they form on the face, the growths eat away at facial bones and tissue, causing parts like the nose or palate to become disfigured or cave in. The syphilis infection also attacks the brain, causing neurological issues like paralysis, seizures, and lack of muscle control. Disfiguring skin lesions that eat away at flesh, leaving visible disfigurements on the face, nose, and other areas. These ulcerations can become smelly and extremely painful. However, luckily enough, upon being diagnosed with it in the early stages, a full course of antibiotics should clear it from your body for good. Meningitis. Your spine and brain are among the few sterile places, meaning they're free from bacteria, viruses, or fungi, good or bad, and protected by a tough layer called meninges. Should anything ever enter this space, your body will immediately enter an overdrive and cause meningitis. Unlike many infections that develop gradually, meningitis can emerge suddenly and escalate with frightening speed. Meningitis progresses so rapidly because the infection directly attacks the special machinery of the central nervous system. As the protective membranes become inflamed, functions controlled by the brain and spinal cord can begin to misfire in unpredictable ways, leading to weird neurological symptoms like very severe headaches, seizures, hallucinations, and even coma. If not treated promptly with antibiotics or antivirals, the unchecked inflammation can cause lasting brain damage, neurological disabilities, or death. The causative bacteria or viruses are often harmlessly carried in people's nasal passages and throats, only to be unwittingly passed through something as simple as breathing the same air as an infected person. Its stealth transmission allows it to hurry through populations. It mimics symptoms of milder viral illnesses like the flu, delaying diagnosis until more distinctive signs appear. By then, critical time has been lost to get ahead of the rapidly escalating brain and spinal cord inflammation.